All right, this is Firecrackers. Let's get straight into the conversation. We will get to the Imo State capital very shortly as we discuss party politics. But let's begin the conversation tonight in Abuja, the nation's capital, as we are joined by the National Chairman, Commissioner for Health Forum. She's also the Honorable Commissioner for Health in Cross River State, Dr. Betta Edu. She joins us live tonight on the program. Doctor, it's always a delight and pleasure to speak with you.
Good evening.
Yes, so Honorable Commissioner, I mean, we're still very much in the middle of the COVID-19 pandemic, but we are now faced with the outbreak of cholera. Just how concerned should Nigerians be about this outbreak and why?
Well, of course, you know, the COVID-19 pandemic has really had its own toll on the health system and indeed the entire economy, and has affected a lot of families, led to malnutrition, rising in the numbers across different sites and communities in Nigeria. Basically, cholera is a bacterial disease that is caused by the Vibrio cholerae, and of course, there are many risk factors that even makes the transmission of this cholera worse. So this bacteria is in the feces, and when it's defecated, of course, it gets water or food contaminated, and when people ingest this, they come down with the cholera. The problem with it is that you continue to stool and vomit, lose a lot of water, and then of course from dehydration the person gets to die at some point if it's not being treated. Of course, in the stool too, you also have the presence of blood. Basically, the issue is that the country as a whole, different states, local governments need to strengthen the WASH program. That's the water and sanitation program. We need to make water available to people in their communities, clean drinking water. When they drink from the wrong sources, that's when they have issues of cholera, and we don't want this to continue. Beyond this, the issue of malnutrition, which is widespread, is also one factor that increases the severity and the transmissibility of this cholera across a community and can lead to a good number of deaths. So we need to do something more elaborate, more robust to address the issue of malnutrition. Finally, it's also important for people to have basic vitamins in their daily food or get supplements for it. The government should be able to provide these supplements across board just to help people to thrive.
All right, thanks for staying with us. This is Firecrackers. Of course, speaking with the National Chairman, Commissioner for Health. She is also the Honorable Commissioner for Health in Cross River State, Dr. Betta Edu, live in Abuja, the nation's capital. Doctor, thank you so much for staying with us. I want you to please paint a picture of your conversations and engagement with your colleagues, Commissioners for Health in the 36 states across the country, as well as your engagement with the Minister for Health, Dr. Sagi Hanire, as regards efforts to tackle the outbreak of cholera in the country. Plus, I understand that your state, Cross River State, is among the 20 states plus, which is also affected by the outbreak. I wonder the efforts you're making to put an end to this outbreak.
Cross River presently doesn't have an outbreak of cholera. We had an outbreak in March 2021, and we have been able to tackle it and bring it to a halt. We identified the source of contamination, and we have been able to do a lot of work around sensitization and around community mobilization to take ownership and work on protecting themselves from drinking contaminated water or eating food that has been contaminated with this bacteria. Basically, we don't have any case right now of cholera. Across the country, a lot of work is being done by my colleagues and of course the Minister of Health, as well as a lot of work is being done by the Minister of Health as well as the NCDC Director General. We have been working together to see how we can improve on the hygiene situations across states. But what's most important is the fact that this issue is not just a health issue. right? We should be dealing on prevention, which is most important. And when you talk about prevention, then you should be working with both the people in the Ministry of Water Resources to end open defecation, to be able to get clean potable water across to people in rural areas. If you're talking about ending cholera, you should also be working with the Ministry of Outbreak and of course the Ministry of Health to improve the nutrition of people in communities. So it's a multifaceted approach to ending the issue of cholera in Nigeria. More effort needs to come in from government, and of course people in communities need to be able to take ownership and do a lot of hard work to protect themselves.
The network seems to be freezing, so let's see how we can wrap up our conversation with you in just a moment. But help us understand the common symptoms of the outbreak which Nigerians should probably look out for. Maybe in 60 seconds, please.
Need to, once you identify anyone in community who is vomiting and has diarrhea, that the person is stooling. Sometimes it could be bloody diarrhea. If they are light skinned, they might appear bluish. You should immediately rush these persons to the hospital and also call on the nearest disease surveillance and notification officer. Look for people with malaise, weakness. Of course, they might have fever and other signs and symptoms that come with the cholera. But the main thing you should look out for is the dehydration, vomiting, and then stooling.
With you without engaging you as regards the COVID-19 pandemic. So let's stop COVID for a moment. As the federal government, we understand, has received the Johnson & Johnson jabs, but is that enough to cater for Nigeria's ever-growing population? I mean, we understand less than 2% of our population has been vaccinated so far. I also understand that the second phase of the vaccination exercise begins tomorrow, 16 August 2021. What else do Nigerians need to know, Doctor?
So first and foremost, the federal government has been doing a lot of work to see how it can bring in vaccines into the country. This has been a tall order because of the global politics on the COVID-19 vaccines. Countries that manufacture it are actually using for their own population first. However, we got Moderna vaccine from the United States of America, and we have also gotten the Johnson & Johnson. This is really not enough to get to 50% of our population as we hope to, but we believe that within the days we'll get more vaccines to come in, both the Pfizer vaccine and the AstraZeneca. Nigerians need to come all out and get vaccinated. The Delta variant is very, very virulent, and we need to be able to work together to end this COVID pandemic as soon as possible. Please get vaccinated, get protected, and this will reduce the number of persons who would die or suffer severe complications from COVID.
Honorable Commissioner for Health, Cross River State and National Chairman, Commissioner for Health Forum, Dr. Betta, I would like to thank you most kindly for agreeing to speak with us.
Thank you for having me.